now, and then I'll.
Thank you very much. Thank you very much, and good evening and good afternoon to you all. It gives me a great pleasure and honor to introduce to you Professor Getwa. He studies medicine in Germany and later specialized in neurology. He also earned his PhD in neuroscience in the United States and pursuing his residency in emergency medicine. Currently, he's an attending physician and director of research and 3D printer medical simulation at New York Metropolitan Hospital Center. And thank you, Professor Getwa, for your time, and over to you.
Thank you very much. And I thank the organizers for inviting me to this session. I will be giving a short version of scientific paper writing and grant proposal. This is a diet version because each individual topic can take hours. Can you hear me?
Yes,
we can hear you. I think we just need everyone else to mute, everyone who's not speaking.
Okay, next slide. Next slide, please. Lam, can I get the next slide?
Yes, but it is stuck here.
Okay. I have nothing to disclose, so I have no financial interest in this. I will try to give you an approach to writing a scientific paper, an approach to writing a grant proposal. Next slide, please. So when you think about these two things, you will have all brain tabs open because you don't know where to start, you don't know how you should move, and you don't know where to end it. I've been there. So someone will guide you through it. Initially, you'll worry about where to start and what to do, but that worry will just, keep you doing nothing or completely overwhelm you. So what you need to do is know few things that you can start with, and then you can build up on it. You will not know everything at once, but if you know the basics, you will learn as you go. I'll give you one of the versions, which is a simple version. Next slide. So let's start with writing a scientific paper. So there are some general rules that you need to know. First, pick the type of paper you want to write. That is always the confusion or the struggle. What do you want, a case report or a case series? Do you want to write commentaries? Or do you have a research project that you want to do and write it? Or is this a review article, which requires a lot of reading and write of summaries? Or do you want to do systematic review and meta-analysis? Or you need some course and help to write this? This is actually one of the easiest. And there are also things called images in clinical medicine. All you have to do is take an interesting case, a picture, it could be a photograph, and a CT scan, ultrasound, and you write a short paragraph, you can publish it. So that is all possible. You have to know what you want to do initially, depending on the capacity of your staff, yourself, and your institution. The next thing you should know is to pick an attractive title. Your title really matters. If you write, "The dog bit a man," that's not as attractive as if you write, "Oh, the man bit a dog." That will be attractive. Everybody want to read that story. But at the end of the day, you still can tell them actually is the dog bit the man and the man got mad and bit the dog. So this is how you present yourself. Start with a nice title. You can also use pre-existing templates for these reports, pre-existing templates for research paper, and systematic review, all of it. So template will help you when you start. Next slide, please. So once you have a title and a topic, what you need to do is go to internet and search for the item. Google is one of the areas you can start. You can do Google Scholar, that gives you the scientific papers. You can also do PubMed or ResearchGate. That is another area where you can find material for you. Once you get that, you check if there is any similarity between what you want to write and the paper that are already published. Is there any difference? If there is any difference, how can you highlight your difference? So that is a strategy you should use. What does your finding offer that the other papers did not express? What you also need to do is you need to follow the author's guideline. Each scientific journal has an author's guide. You have to follow that. There is a manuscript style, there is a reference style. If you have software like EndNote or Reference Manager, they make your life easy. They cost a little bit, but when you have it, everybody can use it. Another general rule that you need to know is spelling error, grammar, and syntax error. Reviewers hate them. You have to brush up. You have to present them a clean manuscript. So follow prior publications for style. How do they describe? What are the phrases they use? That is very important. Show it to an experienced person. If there is someone who has published a lot of paper, give it to them. Let them read about it and comment on it. That helps you. Most journals also require that somebody with actually a native English speaker should read the paper and then go through it. You can also have, again, a software called Grammarly, which will help you, clean up your manuscript. Another area that you need to pay attention is plagiarism. That is an absolute no. You cannot plagiarize. You cannot use somebody's paragraph and put it in your paper. So you can read about it, take that information from other papers, but you have to rewrite it in your own way. You cannot, take a chunk of a paragraph and use it. There are softwares you can use called Viper, Grammarly does it, or other, that you can buy. Some of them are actually for free, the simplest version. Once you do that, the next step will be preparing figures, tables, and videos. You can use Excel spreadsheet to prepare graphs and tables. Adobe Illustrator and Adobe Photoshop will help you prepare your figures. And there is another software called InShot. It's an app that you can download. This is the best thing if you want to prepare your videos, short videos, you can edit them. It's very interesting, very helpful. So how does a scientific paper start, or where does it start? It usually starts with a concept. We have seen a case, or we have noticed several cases with a pattern, and then you do research. So first you have something that you notice, observation, recognition of patterns. It can build up a case or case series. It can also come from your personal experience, expertise. If you have worked in some area for many years, you can write a comment, on that subject matter. You can also write description of procedural techniques. That is very, very important. So people know what are the nuances of procedures. You can also do educational guidelines, about EKGs, chest X-rays, and stuff like that. So all publishable. Next slide, please. Quality improvement projects are another area where you can have a publication. It could be in departmental or institutional. You look at something that can improve patient care, and they are also publishable. There are actually research journals that only publish QI related work. Basic science experiment, it's really hard to do it if you're a clinician, but it's doable. And most of it that we do is a clinical research. That could be retrospective chart review, it could be prospective studies, or it could be, pharmaceutical supported, university supported, double-blind. Other areas for paper, like I said, is review articles or systematic reviews or meta-analysis. That is very appealing these days. Again, ask people who have experience. They will help you, they will guide you. Get data from your institution or get data from the internet, such as trauma registry, cancer registry. You can access all this information and then write a paper from it. Make sure you do a thorough literature search, because that helps you what has been done, what needs to be done, and you'll have your information. These are some of the interesting literature search resources for emergency medicine. Google is good, Google Scholar, PubMed, Corcoran Library, plenty, EM creates number needed to treat, and national or local registries can also give you information. Next. So when you write a scientific paper, there is a format that you need to follow. That is an abstract. The abstract will give a brief background information, the materials and the methods, the results section and conclusion. And then you expand that by giving a background information on the topic. For example, if you're writing a paper on traumatic brain injury, you need to define first what is traumatic brain injury. What kind of traumatic injuries do exist? What are the criteria to classify them? And then you go, what is the epidemiology information on traumatic brain injury? Start locally where you are, go nationally, internationally. So this is how you build up. And then you go to your specific aim. What is your study trying to answer or trying to study? You give information about that. And then you describe the materials and the methods. What material did you use for the study or for the paper? Or what are the methods you implemented? And then you describe your finding. That's the results section. Next. And then you discuss, and then you'll add a limitation to your study. Your discussion will say, this is my result, this is what has been done, this is what I found, and this is how I can reconcile pre-existing informations, my information, and what comes out of it. And that will be your conclusion. You also need to acknowledge people who help you, grants. You have to specify who gave you the grant, what is the ID number for that grant. And then the last one will be reference section. All your information have to be backed up. Everything has to be, referenced. I found traumatic brain injury, A, B, C, D, and then you find where does that information come from? Is that, World Health Organization definition, World Health Organization statistical finding, where does that information come from? You'll have to back it up. And then you do your figures, tables, and videos. Next. So let's go into the details. Like I said, when you describe the background information or your introduction, you'll have to describe what is it. First comes the definition, and then statistics, and then what is known about it. That has to be there. And then specify what applies to your project. Is there an opposing disqualifying information? Do you have any strengthening or supporting information for your project? Nowadays, if you have a topic, you can find an opposing research and a supporting research. You can get hundreds of papers. So you'll have to, weigh in which one do I take, which one should I leave out. Write the major points and leave the details for the discussion board. Next. In a specific aim section, when you write, you'll have to clearly state the study objectives. For example, does helmet use decrease moderate or severe traumatic brain injury? Does helmet use decreases mortality? So what is it you're looking for? What is the question you have before you start your study? You cannot twist yourself into pretzel to answer a result that accidentally came. So you have to define that first. Everything else can be discussed later. Set a clear outcome measures, if any. primary outcomes. Is this days on the scene or days in the emergency room? What is it you want to study? Secondary outcomes, such as how many of them got intubated with traumatic brain injury? Was there any disability within 4 weeks after the accident? So you can have multiple outcomes, but you'll have to define them first. In the material and method sections, you write what materials will be used or were used. Did you use any data from your institution? Were there patients that you included? Were there volunteers? Did you use any device or medication? So that has to be described in details. Write what methods will be used or were used. Were you reviewing labs? Were you reviewing imaging results? Were you reviewing virals? What was it? How did you do your study? Again, it has to be like a cookbook. If I read your paper, I should be able to replicate your study without contacting you. It's like cooking, some fancy food just by reading it. In the material and method section, one thing you should also know is data collection sheet is very important. You have to set parameters to be collected and identify them before you start the study. You don't want to do data collection in the middle of your study. That will be painful and it will also skew your results. So define them. I want to collect age, gender, sex, heart rate. What is it? So make sure you have it. Also use a coding system, because if you use research associates to do your research, everybody will have a different method of collecting the data. When you sit down and try to analyze, it will be a headache. There will be a lot of mistakes and skewed results. So use a coding system. For example, male is 1, female is 2, done. Now you can easily sort out your data when you do the analysis and gather the information systematically and compile them. Next. So in your data collection sheets, you have to define demographics. I want date of birth, name, medical record number. I want gender, or I want to do ethnicity. I want to know the date of service. Make sure you write them what you want, and that should be collected accordingly. You can also have clinical data like vital signs, laboratory results, and imaging results. Data entry is very important. Most people use Excel spreadsheet, and that has to be input clearly. You can also use SPSS or SAS, which are sophisticated statistical analysis softwares too. That requires a little bit of training and some, coding with SAS. Excel is very simple. I use it all the time. You also have to, analyze your data using statistical methods. We'll discuss later. Next. Results section. What comes in the results section? You'll have to make sense of the data. That means you have to interpret what you found. Otherwise, it will be just numbers and statements, sentences in your results section. It makes no sense to somebody that's going to look at the data. So you'll have to tell a story. I call the results section is storytelling time. They have to tell a story from the information you have. Descriptive analysis to express the results, you can use it. You don't have to do fancy statistical analysis. Or you can do also detailed analysis using statistical methods. There is a whole big lecture, what to use, when to use, and how to use it. Prepare figures and tables from the data collected, so it makes sense. It tells a story. Next. So what are the statistical methods you can use? Like I said, you can use descriptive analysis, the mean, the median, and the percentage. Very simple. Chi-square. Chi-square analysis will be used to express proportions of results. Regression analysis, you're looking for outcome based on 2 interactions. You can also do sensitivity and specificity. Here you're looking for a new, for example, device or test result. How good is this new test to identify, pathologies? Positive predictive value, negative predictive values. There are also studies, where you have to do odds ratio in a case control study, relative risk. Next slide. So these are some of the examples I chose. For example, in a case control study, you want to study the link between an exposure and outcome. The best statistical method would be our threshold. Everything else would not, clearly define or describe your results. If there are multiple factors influencing your outcome, then you use regression analysis. There are different types of regression analysis. I will not go into the details. Like I said, the comparison of proportion will be chi-square analysis. So you can consult with the statistician or a senior, author that has an experience to help you with this. In the discussion part, you'll discuss the results in details here. And the discussion comes within context. So you'll have to explain what it is, what happens. You compare them to other studies, and then you tell them, this is our similarities, this is our differences, and the reason for our results is A, B, C, D. The reason for our differences is A, B, C, D. And then you'll highlight your major findings and points at the end of your discussion. Limitation section, this is very important. What you find is probably localized. For example, if you study the rate of hemorrhagic stroke in your hospital, that hospital does not represent the city you live in. It does not represent the region you live in. It does not represent the country. So you cannot make a conclusion just by studying your hospital population. So there will be a limitation where you said, first, my sample size is too small. Two, the population I studied maybe did not include the variety of gender, male to female. Is that equally represented? Old people versus young people, are they equally represented? What was the study setting? Is that an urban? Is that a rural area? Are there any missing data? Maybe you didn't get everything from each patient, or some of them may not, follow up after you discharge them. So were there any failure to follow up? That has to be explained so the reader knows how you found your result, what meaningful conclusion can they take from there. So conclusion in the future directive section is you state what you found, and you assert the relationship between what you try to study, what you found. And then you express your plan for and the goals for the future. And sometimes you have a small finding, but it doesn't tell anything. So you'll express, this can be done in the future. I will do this, I'll do that. And other, researchers will bank on it, and then they can also continue their study by getting idea from your study results. Like I said, acknowledgement section, grant suppliers, facilities, people who help you should be acknowledged. Next. Reference. Every fact stated needs to reference. The original data has to be explained. Where does it come from? Is there an epidemiologic fact? WHO, cancer registry, trauma, where did you get it? Experimental methods. Who did the first experiment? Did you use that method? You have to reference that. And use the reference according to the journal style. Once you have that, the next headache will be selecting the journal. Which journal should I select? So selection of a journal depends on the topic you have, and the region where you live, and the society you have a member. Some want to have an impact factor journal. How about the acceptance rate of the journal and the cost? Unfortunately, nowadays, a lot of journals require payment. And then there is a submission process that could be a little bit of challenge. So what are the journals? Topic related selection. For example, if you do a study on ultrasound, you should submit it to an ultrasound related journal. The likelihood of being accepted is higher. You can also look for the impact factors. You don't have to go aim for the high impact factors. You can go in the middle or the lower one initially if you think the study is not that strong. But if you think your study is robust and stronger, then you can go for the higher impact factor journals. Some people like to publish also in index-related selection. That means, is it referenced in PubMed? Is it indexed in a Scopus? EM-based? Is there directory of open access journals? So they will be highlighted because once you publish in this journal, it will be available to many, many, many scientists, which increases your visibility. But they're also a little bit tough to publish in these journals if your work is not. There is also region-based selection. If you're from Africa, I think you should look for the African journals. Likelihood will be higher, and then you can, go to the others. I'm not saying limit yourself, but make sure based on your work, what is the right place for you to start. There is also subscription-based in open access journal format. The subscription-based is free, but the rate of acceptance is very low. The open access ones, you'll have to pay a fee. Some of them actually waive the fee for low-income country authors, which is good. And they are less competitive, I would say. And there are also some journals from academic societies, and some journals just invite you to publish. This is where you need to pay attention. If you're invited, who's inviting you? Why are you invited? There's so many predatory journals nowadays. They want your money, nothing else. So we'll talk about it, how to look for them. So publish is a subscription. If you publish in this, you say you understand, you have to wait 12 months before you can share your accepted manuscript publicly, and so on and so on. Next. If it's an open access, the journal will make it free for anybody, but then there is a lot of cost. This is, I think, American Journal of Emergency Medicine. You need to pay $3,250 to publish your paper. That's a lot of money for low-income authors. Next. This is where you need to pay attention. Predatory journals. These are journals, they just, exist overnight, and then they will invite you to publish in them. So when you look at them, you'll have to go through a checklist. Are these really predatory or good journals? Is there a website? Is there an editor-in-chief? Check. They probably don't have it. How often do they publish? Once every year? Review the author's guideline. Is there an author's guideline? Check if they charge for article processing fee. Next. So this is how usually comes. They appear like a journal of well reputation, and then you will see there is a grammatic error in the email they send you, and then they said, "Oh, one of our authors recommended your work, and we would like to publish your paper." This is a case report I published, and then they just glorified it because they're just trying to trap you to submit your next paper. So don't fall for this. Next. This is a guy who actually went through some criteria to look for predatory journals. And then it goes through step by step what to look for them. Next. So now once you do your research or your case reports, and then you select your journal, the next one will be the submission process. You need to sign up as a member. Most journals require you to sign up as a member. The predatory journals will tell you, "Oh, you can email me the paper." They don't even tell you to sign up or submit it online. Say, "Just email me the paper and then we'll take care of it for you." So that is a red flag. Fill out the required item. And if there is any disclosure, you have to disclose. That's very important. If you get money, if you supported by pharmaceutical, they all want to know that. And then you have to upload the files. You have to prepare a cover letter, a title page. And then some of them actually want you to request reviewers. If you don't give them 3 or 4 reviewers, they will not process your paper. They will also ask you, are there any reviewers that you don't like to see your work? Which is good, I find it, because if you have a competitive area, they reject your paper, and then They might go with your idea. So you can oppose some reviewers not to see your paper. And then finally you submit. Next. So the take-home message from this first part is, consider every case that you see as a case report. You'll find something interesting in them. Just pay attention. Anything that makes you curious should be a project. Read about it, research about it. And then approach systematically. Don't be all over the place. Just go step by step, like I said, do literature review, consult with seniors or people who have experience, and then follow some templates and some guidelines. Build a consortium locally, nationally, or internationally. This could be started by you guys. You have to create this consortium for research, and then you can exchange ideas, help each other in your expertise from country to country, city to city. There is one for neurosurgery. I know, I think he started in Tanzania. He has a very good group. Dr. Chiarusi, very, very interesting work he's doing. So you guys can do similarly for the emergency medicine. Next. Grant writing. This is a very complicated, time-consuming work. Writing a grant requires preparation. It could be, months. You come up with an idea and a project. And then when you come up, you have to think first, is this a fundable project? What is unique about this? Is this an important topic? You'll have to answer that before you just waste your time writing a grant. You'll have to also look for grant sources. That grant source have to be appropriate to the project you're choosing. If you want to do something resuscitation related, there is a Soul Foundation. If you want to do something mobile application in a low income, there is a Fogarty Society, a Fogarty grant. So that is what you should check. This is where comes this consortium. One experience can be shared amongst others. And then we'll review some grant strategies that you need to know. And then there is also an issue of managing the money you get. That is another headache. Next. So some of the resources for grant is NIH, that's from the United States. NIHR that's from UK. They have several areas supporting research for low-income countries. Fogarty Foundation is another one, and Soul Foundation is another one. They support, low-income countries. You can go to their website, look what is available, and then see if your project fits their requirement. Next. There are also institutional grants. Your institution, if it's affiliated with the university or some Ministry of Health, they have some funding for small-scale projects. Use them, look for them, consult with the appropriate authorities. You can also collaborate internationally with different universities, USA, Canada, Australia, Europe, they all have it. Just look for it. Now comes the preparation for the grant. So we start with the concept of the study, like I said, has to be unique. You'll have to do review of the topic. And then when you do this, at the same time, you should build a reference library. Everything you read, if it applies to you, you keep them, So later on, you can use them as a reference very easily. Like I said, EndNote is a very good software. And then you'll have to prepare the grant proposal or a study protocol. Almost all studies require international institutional review board, as some call them, I think, ethic committee, except some studies are exempted if it's just quality improvement, but there will be a headache to publish it. You will not be able to publish it without the ethic committee's review or institutional review or the permission or exemption. Some grants require you submit a letter of intent. You just give a small description of what you want to do, how you want to do it, what are you going to utilize. That will be reviewed, and then if they like your project, then they will invite you to submit a full application. Then you'll have to go through the whole thing. Follow the guidelines for the grant, very important. Pay attention to spelling and grammar. Similarly, like writing a scientific paper. Consult people who have experience with grant. I cannot emphasize this enough. They've done the work, they have the pen, they jumped all the hoops. So they know what is relevant, what you should do, what you should not do. So use that resource. Similarly, like writing a paper, you'll have to have grant information, you'll have to have your, background information. You have to have specific aim or aims, material and methods, and you have to specify what type of research you're going to conduct. Prospective, retrospective, cross-sectional, what is it? And then you'll have to describe how you're going to do the study. That's where the investigative procedures come. That is where you're going to write the cookbook, so people can follow what you're going to do. And then some require also a statistical method. What are you going to do? How are you going to use it? Once you get the money, then comes pain. You need a grant manager. You will not be able to manage if it's a large scale money. How much does the institution take? I'm not sure how it works in your institution. Where I work, that takes 60% of the grant money I get. You only have 40% of the money that can to use it. They also restrict who you can hire. What is the qualification? How many people can I hire? How much money and how can you use, for example, equipment, salary of your research associates, yourself if you work a lot. How about travel expenses, going to conferences, training expenses? Do you need some training, let's say statistical method or research methods? Can you pay? So all this you have to know from the grant and from your institution. That is always very tricky. And then you'll also have to fulfill the timelines, and there should be a progress report. If you get the money, you'll have to tell them what you've done. You just cannot sit on it and then you have no report, they'll take the money away and then you'll be red flagged. You'll not get money from that institution. You'll have to be careful. Finally, when you apply for a grant, if you use devices, medications, then will be an issue with intellectual property. The grantor may require that you share ownership of your device or something, and then you'll have to be discussed between you two. Data dissemination. How about that? Who can see your data? Can the grantor see your data? Can they tell you what to do with it, how to describe your findings? That is also another area where you have to be careful. So make sure you know all this before you sign any contract. Intellectual property, are you giving away your entire ownership, or are you going to share 40-50? How much data can your grantor see? Do they even have to see it? And then can they dictate what you can report from your finding? Can they tell you, don't do this, don't do that? So that have to be, discussed and then thoroughly processed before you have. Next. I'll wish you a good luck. If you need anything, I will leave my email address. You can contact me anytime. Next. Next, I think 2 more slides, you will see my email. So your speed doesn't matter. Forward is forward. So start slow and move forward. And use my email if you want to contact me. First one is my private email. The second one is my institutional email. You can do it. There's plenty of material in the continent of Africa to study, to publish, and create your consortium, help each other, consult with each other, and advance scientific paper from that continent. I recently gave a talk about 3D printing in medicine. And there are so many publications, and there was not even a single one from the continent Africa. We can do it. We have it. Let's go forward together. And thank you.
Thank you so much, Professor. That was a very, very rich and informative session. We're really humbled to have had this session with you. I would now like to find out from everyone attending if there's any clarification you would like made, or if you have a question, feel free to raise your hand and unmute and ask. I'll give it a few seconds in case there's anyone with a question. Please feel free to ask. Okay. While we are waiting for that, I just wanted to find out, Professor, from your talk today, it just made me wonder, given we are residents and probably we cannot afford $3,500. Okay, it seems like it's a bit expensive for someone who wants to be a researcher. I mean, to start off, maybe doing the research itself or publishing their work. So what kind of advice would you give to residents who are not yet financially able to do that? Is there a way that they could still do research despite the financial implications?
So that amount is for publication. It's called article processing fee, but not every journal requests it. Some of them waive that for low-income countries. If the author, the first author is from a low-income country, you don't have to pay it, but you'll have to show that you're from a low-income country. We can compile those journals and then create a list. One. You can also submit as a subscription base. That means, they will take the rights from your publication, then they will not charge you. So there are two options. The open access are the ones that require money, and you don't have to, publish in your open access journal.
Okay, thank you so much for that. I have a question in the chat box. Someone was just curious about whether you have any, they were mentioning particularly the predatory journals that you brought up. And if perhaps you could share a list with us of the ones you're aware of, which we could share with the rest of the Delta group, just for them to watch out for those people and make sure that they don't get caught in that.
There is a website, and I think it's in part of my lecture.
Okay.
You can use that website and they give you all the predatory journals. They update them. That is a librarian who created them, and then you can find out. It's in my lectures. There is a link. Okay.
So we shall refer to that link and maybe generate the list and share it with everyone. And I have a final question. Could you just let me know what the difference is between writing a proposal for, let's say, a scientific paper and writing a proposal for a grant? Is there a difference in generally, like the main difference between the two types of proposals?
The scientific paper you're writing a story from what you have. A grant proposal is you're asking for money, you're proposing, this is what I'm going to do if you give me this money. It's just the way of description.
Okay.
Yeah. But the format is pretty much the same, except in the grant, you'll have to tell them, this is what I need your money, this is what I'm going to do. But the paper is you just write your results. So this is what I have, and then this is what my finding.
Okay. And how about the finances of when you receive money from the grant? You mentioned that the institution will take most of the grant money. And why is that? Why would they take the money and yet you need to actually conduct the study? It doesn't make sense. Yes.
So it's not the same for each institution, but they all take money, as far as I know, at least in the US. I'm not sure in the continent Africa. So the reason they take the money is they're providing you the venue, the hospital, the resources for you to do research.
Okay, that makes
So that
sense
is
now.
what they take it. Yeah, you could do individual study somewhere else, then they wouldn't take it, but it's going to be hard for you to get all the information. So they provide you all that venue, resource for you to work. So that's why they get. Some take 20%, some 40%. My institution takes 60%, unfortunately.
Okay, thank you for that. Then my final question is, what is the likelihood of someone who has not had, let's assume someone has a very good grant proposal, but they don't have a background of carrying out a lot of research. So my question is, how likely are they to actually get the grant, or is there something we residents must do if we want to potentially be more likely to be awarded grants? That is the final question.
So the best thing is to collaborate with institutions that have experience or researchers that have an experience. You know, their name will be highlighted, have the expertise. So the likelihood of getting a chance, getting a grant is higher than if you submit as a novice. Nobody knows you, you don't know the background. It makes it difficult. So try to collaborate initially until you establish yourself. You know, there are so many visiting professors, researchers, different areas, Canada, Europe. Try to work with them, or even within the continent Africa. There's so many established researchers. If you work with them collaboratively or as an advisory firm, then you have a chance of, you know, because they know how to write the grant. They tell you what needs to be adjusted or corrected in your proposal, which will make it easier for the reviewer to see and fund your proposal. So collaboration.
Okay, thank you so much. Thank you so much, Prof. Is there anyone who would like to ask a question before we close this session? Any final questions or comments from the group?
Faith, can I share mine?
Yes, please go ahead.
Yeah, Professor, this information has given me a little bit of thoughts, particularly regarding my project proposal for the residency program. I am doing research on the operation of land ambulances in the country, particularly interested in looking at the current practice in terms of patient handling for the ambulances that dispose patients to the national referral hospitals. Now, my question is, if I'm looking at operations, I'm looking at the current practices, does this make it look like I'm writing a scientific report? I mean, where do I classify this? Is this a research proposal? I'm trying to document something that in the end will appear to be a scientific report that I have made regarding the operations of the EMS services in the country.
So what is, like I said earlier, the outcome measure you set in your specific aim determines what kind of paper you want to write. If you want to see the operation with the ambulances improves patient care, they get better, that might be just a quality improvement. But if you want to see, for example, the outcome, you know, by taking them earlier, you improve their survival rate, mortality, something that will be a research project. If you just review charts, that will be a retrospective. But if you do it prospectively, you follow everybody, you write your data, then that will be a prospective study. So what is it you're trying to answer will determine how you want to prepare your paper. There, you know, they always overlap. They're not like black and white. So what is the outcome measure you're looking for? How good the system runs, or if it has any impact on the patient for example, survival, you know, what is it you're trying to answer with your study?
So I am not, so in the country, as we know, EMS is a new practice in the country in terms of, especially in terms of recognition and its impact on the general healthcare system. So currently in Uganda, we have only put things, we have managed to put things on paper. We have developed systems that are, you know, undergoing quality improvements year in, year out. And my question, the question I'm raising is, even as we develop these documents like emergency medicine policy document, policy document, do we actually practice this? If a patient who requires advanced management at the time of calling for an ambulance, if the patient requires an EMS service and calls for an ambulance, and so appears that this patient requires advanced management all through the way to the hospital, which kind of service do we give this patient? Is it practice that, according to the policy guideline that we have been given, is it often practice that these patients likely will likely receive the service that is commensurate to the medical requirements of the patient? What is obviously seen is that we pick up a patient and deliver to the hospital, but the requirements of these patients are not paid attention to. So what I'm trying to do is to document these gaps. Is there actual practice in terms of recommendations and in terms of the guidance that has been provided, or even as we continue developing systems, we also continue to practice the things that we have been practicing in the past? So I'm trying to put this together because that information is lacking. So if